Hello there and welcome. Today I want to talk about anti-nutrients. I've known for some time that malnutrition is one of the causes of illness and that medicines always come with side effects. But until recently I had no idea medicines can act like anti-nutrients. When I thought if this is misinformation, I reasoned that it isn't because knowing how the powers that be work, it makes sense that they will give us anti-nutrients. It also makes sense because doctors are blinkered into recommending only medicines as a course of treatment. This is because their training is sponsored by Big Pharma. Anti-nutrients are substances to which we are all exposed to through food and water that antagonize nutrients needed for health. Some anti-nutrients bind to other nutrients, making them useless. Others tie up enzymes needed in digestion and other body functions. Some cause problems by creating a greater need for certain nutrients, while others cause nutrients to be excreted more rapidly from the body. In our world of advancing technology, the level of anti-nutrients to which we are exposed to is surprisingly high. Many of the anti-nutrients have either a direct or indirect effect on immune function. Anything you can do to reduce exposure to anti-nutrients will be helpful in preventing recurrent illness. Table sugar, food coloring, processed fats, and additives like MSG often act as anti-nutrients. Many pesticides are sprayed onto fruits, vegetables, and grains. These chemicals have many adverse effects and are more of a problem than most would imagine. Caffeine is another serious problem that most people don't fully understand. It is a nervous system exciter, which means your heart beats faster, your breathing rate increases, and your blood pressure rises. All these things help in a fight or flight response, but have too much caffeine and it can cause a lack of sleep, inability to relax, and perhaps a heart attack. Medicines constitute another important category of anti-nutrients. If the taking of medicines is short, the effects are minimal, but if medicines are taken for a long time, for example months or years, the nutritional effects of the medicine has to be taken into account. Some examples of nutrients affected by medicines are antibiotics that are used to treat bacterial infection that affects vitamin K, vitamin A, vitamin B12, magnesium, folic acid, vitamin C, and vitamin K+. Aspirin used to treat pain and fever affects vitamin B1, vitamin C, and vitamin K+. Cortisone used to treat inflammation and allergy affects zinc, vitamin K+, folate, vitamin B6, vitamin C, vitamin D, and calcium. Ritalin used to treat hyperactivity and attention deficit hyperactivity disorder suppresses the appetite. Phenobarbital used to treat seizure disorders affects vitamin C, vitamin D, calcium, magnesium, and folic acid. Tetracycline used to treat infection affects zinc, calcium, iron, magnesium, vitamin K, vitamin B2, vitamin B3, vitamin C, and folate. No wonder people who take medicines get worse. Vitamins get their name from vital mineral, and the zinc, calcium, and magnesium are very important too. No wonder some people look for alternative solutions. Thanks for listening. Bye for now.